Hi, good afternoon, everyone. I welcome all the viewers on today's webinar, which is nothing but end of life. If imagine if there are only birth and there is no death, but as per the human biology and the nature, if there is birth, the death has to happen. Why we have chosen today the topic on end of life is because the end of life policy is very complex in nature and due to multiple decision makers in this policy, especially the family members, we have chosen this topic for the nursing awareness webinar today. I welcome Ms. Moite as Shanti Bhattacharya. I am this moderator today in this session. Shanti Bhattacharya, the Vice President Nursing, Yashoda Hospital. I would like to take the credit on calling upon Ms. Moite, who is a Senior Nurse Manager and logging in from Hitec City, Yashoda Hospital. I do take the immense gratitude and pleasure, and it is giving me a lot of joy to call the immense leader, nursing administrator from Apollo, Kolkata, Multispeciality Regional Director, none other, Miss Madhukari Ray. She has the vast experience, direct experience of 32 years in director nursing administration. Her favorite subject is she's very quality conscious, a lot of abstract paper presentation, a lot of seminars, and a lot of quality update program she has done in her tenure. Rightly, she is there with us, but due to little issues, she's not able to connect. But very soon she'll be there with us. Now, I would request Moite to start the presentation.
I could not see. I could not see.
I share.
Share. That is the starting.
You can talk.
No, you share. That is the starting.
Moite, start.
There is no real ending. It's just the place where you stop the story. And life has to end. With this beautiful quote from Frank Herbert, I would like to introduce myself here. I am Moite, working as a senior nurse manager in critical care unit, Hitec City, Yashoda Hospitals. Today, we will discuss about end of life care.
Moite, go on. We can't hear them.
Now let us see the priorities. The top 5 priorities which we focus on are recognizing that someone is dying, communicating sensitively with them and their family, involving them in decisions, supporting them and their family, creating an individual plan of care that includes adequate nutrition and hydrations. We should understand that every individual has their individual plan of care. So based on that, we should create a plan which includes adequate nutrition, at the same time hydration. The goals are to control symptoms, identify patient needs, promote meaningful interaction with the patient, offer support to patient to live as actively as possible until death, offer support to the family, facilitate a peaceful death. The importance are care of the whole person, that is nothing but a holistic care, support meaningful living, supports the family to cope with loss and grief, respect personal, cultural, and religious values. Always understand your patient's religious value and respect it. Value ethical principles. Here, the ethical principles is nothing but giving a time or a decision making to the patients or the family members independently. Now, if we see
Moite,
about the holistic...
Moite,
Yes.
I would like to pause you for some time. I just wanted to check whether Madam has joined.
Yes.
I have joined. Good afternoon, everyone.
Yeah, good afternoon, Madam. Very glad to have you in our platform. Yashoda
Thank you so
Nursing,
much.
yes, Yashoda Nursing Department and Yashoda Management is very grateful and thankful to you, and we are honored to receive you here. My first practice would, I want to just ask the question in terms of how do we, assess the knowledge of the nurses, because as we all know as a leader, this end of life is a very complex policy. How a fresher would, channelize the information if she is on the shift, or will she be able to take the help of the seniors? What is your take on this point, ma'am?
As a caregiver, when we are taking care of patients with end of life care, it is a holistic care definitely, because it is not only the care of the patient that nurse has to take care, it is also the care of the family and all the caregivers that are there connected, those who are connected with the patient for giving care. So it is an holistic, it is a team approach, and it is not only that it is a team of doctors who are actually basically looking into the treatment. It's also the nurses, those who are taking care of the patients in every shift. It's also the caregiver at home and the family members, those who are thick and thin, next of kin of the patients, and the other caregivers like even a housekeeping staff, even the person who gives food in the hospital or at home, whoever is taking care holistically for the patients, any need activities of daily living and other care. Everything depends, whoever is connected for all these services, all are part of the team and they have to be taken care. The nurse has to be in sync with them in terms of deciding on how to take care of this patient, because there are many factors which are responsible, which are actually, there are many factors which are to be looked into. The nurse has to look into. So it is very important.
So would you want to say that we do empower our level-wise nursing team to break the bad news to the next of kin or surrogated attendant? How do we prepare our nurses in such a scenario?
Yeah, I think it will be better if she finishes her presentation, then I will talk about this, because I think she will talk about, she's talking about this holistic care and she's talking about other things also, I think. So yeah, she can finish. Yeah, she can finish and then subsequently I can take up this question.
Okay, ma'am.
As you feel. Yeah.
So now let us see the holistic care, as ma'am has mentioned that it is the whole of a person, which includes the physical, psychological, psychiatric, social, spiritual, ethical, and legal. Social and psychological, if we see, it is going to be helpful for the patient, at the same time for the healthcare professional too. By doing the psychological interventions of the patients, we can use the knowledge in our healthcare practice. At the same time, spiritual care, we can help the patient to help to deal with the health challenges by diverting their mind into the spiritual way, like prayers or allowing them to spend in the natures, etc. Now let us see few symptoms in the end of life. That are breathlessness, pain, nausea, vomiting, anorexia, oral problems, excessive secretions, agitation, restlessness, diarrhea, depression, confusion, feelings of loss and grief, spiritual or religious abandonment. Commonly, these symptoms we are evident in the last days of the life. Now let us see the nurse's vital role. That is nothing but empathize and facilitate open discussion with the help of clinicians. That is, provide guidance in understanding medical options like hospice, palliative care, or oxygen therapies, etc. Then be direct yet caring, use simple languages. This is very important part in communicating with the patients or the patient family members, that when we are communicating with them, we should be direct, at the same time empathetic. At the same time, we should use a language which, or the words which we use should be understandable to the patients or to the family members. Make recommendations regarding appropriate selection of treatments, example, change of positions, nutrition, hygiene care, etc. Clarify the resuscitations orders, initiate exit process, and spiritual needs. In this point also, why we need to initiate means the patient attenders will be in the grief and the sorrow. That is the time when they want to exit as soon as possible. So due to our hospital processes, we should not make the attenders to wait for a longer time. We should give them a priority basis to exit the process. Support to a grieving family, which is very much important for in the hospital setup. The important way for nurses and doctors to demonstrate their understanding of patients. That is by touching them, by showing them our empathetic natures, by giving them a personal space, we can support to the grieving families. Now let us see about discussion whether to attempt CPR in EOL scenario with indicated do not resuscitate. As per the medical law of India, up to now, we didn't get that, it has not yet framed that DNR can be announced. So decision made in advance about whether CPR should be attempted must be based on the circumstances of the individual patients, take into account their wishes and preferences, clinician's order. It should also involve discussion with members of the healthcare team, hospital administrator, as well as with those close to the patients. Informed and documented consent to be obtained. It should be well communicated and documented in the patient record. In short of all these discussions, I would like to say that be empathetic. Family members of dying patients want respectful, dignified, and compassionate. With this, I would like to pass on to Ms. Shanti. Thank you.
Okay, so ma'am, you're there, ma'am?
Yes, I'm there.
Okay, so I would like to put the questions, repeating the questions, like if we have nurses who are on the shift, and do we empower our level-wise nurses to break the bad news? How should they break the bad news? And what are some kind of training should we provide, or some kind of specialized training to be provided? Because these nurses are sometimes juniors, mid-juniors, seniors, all that. What is your policy in your hospital? We would like to hear from you, ma'am.
Thank you so much. First, I should convey my thanks to you, Dr. Shanti and Ms. Shanti Bhattacharya and Yashoda Hospital for giving me this opportunity to be one of the speakers, one of the panelists, and just share my thoughts and the entire gamut of end of life care is a very difficult topic when the nurses have to practice it in true sense. So I really feel privileged to be part of it, and thanks for everything, for giving me this topic. Yes, it is very true that breaking bad news is a very difficult task, especially these type of patients when the family member knows very well about the disease process, and they are very much into the process of going along with the patient. Every day they will see patient is deteriorating, condition is deteriorating each time, each day, day by day, and they are not ready to accept being very like thick and thin of the patient. But it is true that they have to undergo these, they have to face this situation, and they have to be with it. And that is the reason for the nurses and the entire healthcare team, it becomes very difficult when they have to break the bad news. So breaking the bad news it is a team approach. It should not happen alone by a nurse. There should be a team of doctor, the nurse, and if the other counselor, if it is they are present in the hospital, and also the other caregiver, like it may be a dietitian, there may be a dietitian, there may be other clinical pharmacists, those who are involved in the process. Because if the patient is in the hospital, the very closely patient gets associated with the service providers, different service providers. So the team member can be there, should be there as a team. Then they should be talking about like initially it has to be like very sympathizing with the patient family members, asking them, taking them into the confidence that how much they are ready to accept the truth. And so once the news is being broken, before that the doctor has to start with the disease process. How definitely I'm sure that with the disease process we have to also as a team we have to also talk about how long, what is the outcome of this disease, how the progress happens in this disease, so that whether we can expect that the progress in terms of patient's recovery is expected or not. So these things are very important. But we also, while breaking this, while discussing this, we also have to ensure that patient family is able to take it. There are patient families, those who know, they are educated, they know very well about the disease, so they accept it. Okay, we understand, but we can conduct a board. The best is that we should have a medical board. We should give them an environment, make them at ease, and then talk about the disease process. Talk about the disease process, about what has been happening before, what type of treatment has been given before, so that what did work well and what did not work well. And after that, what is going to be the progress and how long it might take approximately. You cannot say that, say, somebody will die in 3 months' time, somebody will die in 6 months' time. It cannot be said. But yes, it can be said that, and like slowly the disease will progress towards that. So whether the family members are agreeing to go with that, or they want like DNR, what she was talking about, DNR. Of course, we don't have that. Legally, DNR is not accepted in our country. But then in that case, the patient family has to be explained about it, that DNR is that patient, what sort of care they will, up to which type of care they will accept. Like it can be if the patient needs any emergency care, whether that they will agree to it or not. If the patient needs, say, the supportive care or palliative care, what sort of care that patient will be needing. It is a combination of palliative, it is a combination of palliative, supportive, and the symptomatic treatment. But whether the emergency treatment also they will agree in terms of if the patient needs intubation, whether intubation will be allowed. In that, since we cannot say DNR, we can always take a refusal consent from patient family, saying that if they are not agreeing to intubation, if they are not agreeing for ventilation, if they are not agreeing to that, we can take a refusal consent in that any high-end procedures in terms of say central line or maybe any other procedures, any emergency surgery if it is required, that is also they are agreeing to it or not, intubation, ventilation, they are agreeing or not, or the end of at the when patient like daily patient goes into cardiac arrest or something, whether really all sorts of care to be given or not, this can be explained well, and then the consent can be taken in a refusal consent from the family members, and then so that family member is totally aware of the progress of the disease and the forthcoming news, like what is going to happen. So they will be ready to it. They will be accepting it slowly, and of course, but when the news, this type of patient's condition is being spoken to the family members, it is important that we ensure that how well they are able to take it. Also, if they need any more support, many a times we found that some of the family members are not able to take it, they have fainted or something like that happened. So we should
So,
be
ma'am,
prepared enough to take care of
I
that.
would like to interrupt. I would like to interrupt you here. Sorry. Like, so these activities, complex activities, when we want to communicate on the daily note. So, do you think we should have some support group or the team approach, like clinical doctors, nurses, some psychologists, somebody counselor, or some therapist should be coming into the hospital because maybe their family members are requiring to have such kind of communication and the conclusionary note from them. What do you say about it?
See, it is the family members would always prefer the treating consultant and the psychologist who are in the process of taking care of the patients. They don't need a counselor from outside coming and doing counseling who had not been as a part of the treatment at all. Because this is a time where patients are chronic in nature and they undergo treatment for a long time. And that is the reason the family members are very, very particular about who all have been involved in the process of taking care. They should be in the team, not other outsider anybody. So that is very, very important. And also we have to ensure it is not that mere the staff nurse level, those who are giving care at bedside, they can be part of it, but they should not be the part of the communication. When we are breaking the bad news, there should be a senior level, a supervisor or an in charge, those who know very well, those who know are able to assess while talking what sort of how they are being receptive when you are breaking the bad news. That is very important to assess at that time when we are counseling the patient relatives. So that is the reason there has to be a supervisor or senior somebody in the nursing level. They should be involved in the communication along with the consultant, intensivist, psychologist, everybody, counselor. If the hospital counselor is involved in the treatment process, then all of them should be there, but otherwise not.
Thank you. Having said so, the last question, how do we evaluate? Like what could be the mechanism of evaluating the, total concept of this end of life care and these complex issues? Maybe there is, I know we practice audit tool projects and other sort of academics. What do we have little, something which is very different to just get to know the awareness? Do we have some OJT, some exclusive training or anything else? Would you want to quote?
Yes, every hospital, whoever is having this type of patients, especially we see end of life care in cancer patients mostly. So nurses have to be, so that their actually hospital has to have a policy of end of life care, and the policy has to be known by all caregivers. It is important because everybody has to know their part of responsibility and they have to render that. Like nurses have to know the main role of the nurses are, they are actually giving the hands-on care. So they have to take care of activities of daily living. They have to take care of mental well-being of the patient, because patient might at times be very aggressive. Patient might not feel like, will refuse eating food, doing anything or talking to anyone. Meeting, at times they will refuse to meet family members even. So that is the time, even there, in my experiences, there had been lot of incidences where we have seen the patient is not wanting to tell the very personal thing to family members, but they are open to, because they are afraid that they know that they are going towards the end of life, and they know that if they tell family members, they'll be very upset. So considering that, they want to open up to the nurse. So the nurse has to be very, very empathizing, and the nurse also has to be taking care of their mental well-being, that's so well connected, that so that the patient is able to say, I am telling you, I'm just giving an example. We had a COVID patient. I was working that time in Calcutta Hospital in Kolkata, CMRI. A COVID patient had given a letter in that he has written that entire his property paper, he handed over, handed over that letter, he handed over to the nurse, saying that you give this letter to only my wife, his wife's name, address, contact number, everything. And he said, just because I'm not able to meet her, I don't want to give to anybody else in my family. I want this letter should go to my wife only. And I am giving, even when he came for admission, he brought a key. So he handed over that key along with that letter to the nurse and said that, will you be able to promise me that you will give personally to my wife only and nobody else in my family? Because I know I am not going to survive. So this is very, very touchy. And there it is, that is a nursing is required for these type of patients, those who are at end of life care. I had my father in end of life care. He was, for 7 years, he was at deathbed. And we have seen that how my mother was knowing everything. But even then, it was so difficult for her to accept that he is not going to be there anymore. I have seen the dedication in my mother, every 2 hourly getting up, giving nebulization, knowing that this nebulization is not going to help her, help him much. Even then, she was feeling that if this dedication can give him, at least keep him at ease. These type of feelings, when the family member is going through along with the patient every day in and out, it is very, very important that a nurse takes care of that close family member as well. And you will not believe in that but previous incidents that I told you, we made it an arrangement from the hospital to take that nurse along with that letter and the key, went to his house, handed over everything to his wife, and then took a picture and then came. So we did it because that is the commitment and level of communication the nurse should have with the patient who is in deathbed. So the policy is very important. Nurses training is very important. The nurse should be, why we keep teaching nurses empathy, but where the applicability of empathy in which all cases, how it should be, is very, very important.
Very, very important.
End of life care has got complete different attitude and complete different ball game, which nurses have to really learn. And that comes with experience.
Yes, ma'am. Thank you so much. And really, I appreciate the right statement and very touchy statement which you have provided to all of the nurses. I'm sure they will be benefiting out of this session. And I know we can keep talking about end of life concept for throughout the day and week, and ma'am, because a lot of review of literature and a lot of articles which is published regarding DNR, whether continuation of the care or not, all that. But still, because we are time bound, and I thank you so much, ma'am. We will be connecting again in future. I'm sure whenever I visit West Bengal, I will definitely come and meet you. And thanks from Yashoda Management, Dr. Pavan Gorukanti, who is a brain behind this nursing webinar academics. I thankful to him also, and I'm sure we would also love to visit your facility. Thank you so much. And
thank you so much.
Thank you.
You are most welcome. Please do come and contact me. I'll be very happy. If I'm there in Hyderabad, I'll definitely connect you.
Sure,
thank you so much.
Thank you. Sorry. I wanted to invite you as well. Please come and visit all our 4 facility. We would love to take you for our medical tour and all nursing facility SOP tours and all. Thank you so much.
Thank you.
Yeah, Moite, thank you. Well, wow, good presentation. I would like to thank all the IT and digital and nursing education and everybody else, especially my nurse manager and senior nurse manager, who all are preparing so well and coming forward to present their presentations. Thank you so much.
Yeah,
And
even from my hospital, nurses have joined. So I'm thankful to all the nurses present here, and it would have been good if we would do some, question answer session or something.
ma'am.
But because of the paucity of time, this time we couldn't
Yes.
do. But yes, there are a lot of questions
Yeah.
should be coming from the practicing nurses on
Yes.
end of life care, how they should tackle.
And
So,
unfortunately, in Hyderabad, it is raining very much, and that is how I think we could face another 75 minutes the technical IT problem, but we could cover everything. Thank you so much, and
thank you.
to the audiences, stay tuned till the next Thursday again. We will be bringing a lot of other webinar topics. Anything you want to quote your questions, you can just drop in the chat box, or you can just ask us by communicating with us in through the Facebook link. And stay safe. Thank you, and we'll see you all later again on this Thursday. Thanks. Thank you, ma'am. Thanks, Moite.
Thank you. Thank you.